Hi friends, thank you for tuning in to the Concussion Coach podcast. I'm Bethany Lewis, the Concussion Coach. I'm a neurological occupational therapist and certified life coach, and I specialize in guiding people through their concussion recovery journey. I am passionate about helping people understand their injury, speed up their recovery, and reclaim control over their life post-concussion. The purpose of this podcast is to help increase awareness of concussions and the impact they can have on a person's life, and to bring hope to people who have suffered a concussion and those who love them. I firmly believe that sharing stories and knowledge about concussions will bring important light and understanding to this misunderstood and often invisible injury. The information in this podcast is meant to bring that awareness and hope and is not meant as medical advice. The opinions shared are those of the interviewees and my own. If you are suffering with lingering concussion symptoms, I have created a concussion coaching program specifically for you. I will be your mentor to guide you through your recovery journey, offering help with understanding and managing your symptoms, setting achievable goals, and learning how to manage your own thoughts and nervous system in order to get control over your life again. If this program sounds like something that would help you or someone you love, sign up for a free consultation. In the consultation, you'll get valuable information and resources and gain hope for your future. Sign up for your free consultation at the link in the show notes or at my website, www.theconcussioncoach.com. Hi, friends. Welcome back to the Concussion Coach podcast. Today, I get to introduce you to a fellow concussion-informed occupational therapist who is making a difference in Texas. Emilie Klingman obtained a Master of Occupational Therapy with a pediatric emphasis from the University of Oklahoma Health Sciences Center in 2010 and a Bachelor of Science in Health Sciences with a minor in Child Developmental Psychology from Southwestern Oklahoma State University in 2007. Her clinical occupational therapy experience includes pediatric outpatient, acute care, and school-based settings. She's on the verge of launching her own business, Summit Concussion Therapy, which will provide community-based concussion rehabilitation services and educational resources. Emilie is specially certified in remedial vision rehabilitation from Salus University, where she is pursuing a post-professional Doctor of Occupational Therapy degree and completing research on pediatric concussion. She's also finishing a fellowship through Neuro-Optometric Rehabilitation Association, or NORA. Having spearheaded the development of a multi-site concussion program in her former role, Emilie has experience in program building, curriculum writing, mentoring, leadership, and interprofessional collaboration. She has served in various positions for the Texas Occupational Therapy Association. She guest lectures for MOT programs and presents continuing education courses on pediatric concussion, pediatric vision, and professional growth. Emilie's professional interests include pediatrics, concussion, vision, and mentoring. In her leisure time, she enjoys practicing yoga, traveling, and hiking with her husband, Peter, and their pup, Patty. Thanks so much for being here, Emilie. I'm excited for you to share your experience and knowledge with us today.
Thanks so much for having me on.
Yeah. So let's just start with having you tell us a little bit more about you, what got you interested in occupational therapy in the first place, and what brought you to focus in on concussions and head injury.
Sure. Yeah. So science was my favorite subject as a kid, and I just gravitated towards learning about the human body. I actually broke my foot in 8th grade and asked the surgeon if he could tape my surgery because I wanted to see it. And then
did he do it?
No, probably liability,
Yeah. Probably.
And as far as what led me to OT, PT actually led me to OT. So I was a multi-sport athlete growing up and had a couple of minor injuries and then that broken foot. And I had this amazing PT, Melissa Kilgore in Shawnee, Oklahoma. And she kind of spurred my love of you get to help people recover and return to their lives. And then as a junior in high school, I found out about OT and I was like, well, that's similar, but different. Let me learn about that. And so what appealed to me more about OT was the holistic approach. And I think all of healthcare is trending holistic, but for OT, we did holistic before holistic was cool. And I was intrigued not just by how the body worked, but how the mind worked, how people think and behave and how they experience the world around them. And I just liked where the science and psychology and the function met. I also have a brother with a rare condition, and I understood, more about that as I got older. But in our small town, and when he grew up in the, 70s to 90s, there just weren't many resources. And so as I learned about his story and knew I had a passion for working with kids and, kids with disabilities in particular, I just thought my goal isn't to fix anyone. I think disability is unique and natural. And there are some, conditions that we as OTs work with where we can get people back to prior level, and there are some where we can't. And so I thought, if I could at least make their path easier and walk this path with them, that's what I want to do. So that's what led me to OT in general. As far as what led me to concussion, I kind of always had an interest in vision, and shout out to my low vision professor, Cindy Robinson at the University of Oklahoma, who piqued my interest in that in OT school. But I was kind of working more with the low vision population at the time, with kiddos that had cortical visual impairments, blindness, that visual field cut because of various traumatic brain injuries. And I just kept thinking, like, there is something that's missing. I know there's something that's missing, and I really think it's vision. And so I took this course by neuro-optometrist Mary McMains Beck, and it just covered this big plethora of visual issues kiddos can have. And she kind of started to talk about concussion. And I just remember this so vividly, because it was like, I had just come off of this 5-day, 10-hour-a-day work week. And it's like, to weekend long continuing ed. And it's like the 11th hour or 14th hour. And she started talking about concussion. And I was kind of like, well, that's just that's PT, that's sports med, because I didn't know any OTs in concussion rehab. And then she starts talking about well, there are these visual issues. And I'm kind of perked up, my ears, my dog's ears. When I say, you want to go outside, it's this, oh, you have my attention, Yes. And then she said, talked about these sensory sensitivities. And I'm like, well, that's OT. And she talked about these physical activity limitations and the mental health impact. And I was just I remember where I was sitting on what floor, and it was in Houston, Texas. And this just huge light bulb moment for me. There was that is so OT. And I was, like I said, my caseload was low vision and just I was at a large pediatric hospital. So we saw, rare things and severe things, and I was immediately drawn to concussion. And one of the other things she said, these kids are the invisible walking wounded. Mm-hmm. And she said, if they have a moderate to severe brain injury, they're hospitalized, their parents get more education. Oftentimes you can see it. Maybe they have a limp or they speak a little differently. You can see it. And she said, with concussion, they experience this. Sometimes they go to the ER, sometimes they don't. But they're just thrust back into their lives, often without school accommodations, with little education. And because it's not visible, people don't recognize it. And that really struck home for me for some reason. And I was just very drawn to concussion from that day. I became completely obsessed with it. We worked 4-10s at my hospital. On my days off, I would just dive into the research, call around, see if I could find a mentor, observe neuro-optometrists, things like that. And I just totally nerded out about it because I was this is it. And I started getting a ton of referrals, and my caseload quickly shifted to 90 to 100% concussion care. So yeah.
Wow. I love that. I love your passion. I can just feel it radiating off of you. I love it so much. And I think it's so important that it's I'm so excited to be having this conversation with you, because most of the people that I work with and that I talk to, even the other professionals, we're working with adults or older, teenagers who have it. And I think that the little kids can definitely have concussions too, but people, and I think to some degree, kids' brains probably bounce back faster, which we can talk about, but this is an issue for children too. And I think this will be a really helpful conversation for me to hear and for other people to hear as well. So thank you for your passion. Thank you for being here and for everything that you've studied and are learning and are willing to share with us. So that's amazing. Tell us a little bit about your experience starting a business and what prompted you to move into that route of doing your own thing. And are you still working at the hospital, or tell us? Yeah. Yeah.
So I kind of and I know this is kind of something we'll talk about in a little bit too, is I kind of started my own business out of necessity. I was never I want to be in private practice. I was at, like I said, a large pediatric hospital. They had a big Medicaid population. We took all kinds of insurances too, but I'm from an impoverished area in Oklahoma. My home county, I think at least on the 2010 census was average income $30,000, few resources, and 90% of kids are on free and reduced lunches. So I really felt a calling to be at that place because I felt all people could reach care, and I didn't understand how that would ever work in private practice. And I'm learning about different models because that's, a core part of what I want to be able to offer is people, care to people at different price points and different levels of income. But I initially left my job because I had experienced a lot of bullying, which we'll get into more, I think, later. And it was really taking a toll on my mental health. And so I quit. Like I just made a decision. And a few days later, I was handing in my resignation and I had no plan. I didn't have another job lined up because I was very happy there. 99.9999% of the people there were amazing, both people and providers. I grew a lot there. They were very supportive of me starting the concussion program and building it. And just there were just a lot of amazing things about it. And so when I left, I was kind of like when a toddler goes to their like favorite auntie's house and they don't want to leave because it's so fun. And like, they're like clutching the leg and like kicking and screaming. Like that's how it felt, even though I knew it was the right decision for me. And so I decided to take a few months off to heal because, why did I think healing could be put into a time frame? It couldn't. And as I was starting to look at jobs, I was just going into fight or flight, looking at other jobs, seeing people in scrubs. I was having panic attacks going, the night before going to professional conferences, which is all very not me. Like I am like extrovert to the max, take full advantage of conference. I want to be doing every event. And I kind of had to take a step back and be like, my body is trying to tell me something. I'm not ready, And so I started talking to people and they're like, why don't you start your own private practice? And I'm like, oh, that's not for me, And then I kind of had started taking some business classes just on the side, really for some other like interests of mine. And then I started learning more because I was just like, I'm an OT. I know medical. I do not know business, like all of these terms like finances and marketing and all these terms, like it's totally foreign. And I started thinking like, okay, maybe I can do this. And then I went to our state conference, and Texas is fortunately starting to recognize kind of non-clinical classes as continuing eds and approve those. So professional development, management, leadership, all these things. And there was a group of, it just happened to be all women who just, put on the little conference chat, like private practice meetup at lunch. And I just went. I was just like, I have nothing to offer. I don't know anything right now. I'm here to learn. And that group is just, we still meet like quarterly and we have a Facebook group that answers each other's questions. But that group really was encouraging and helped me kind of a step-by-step, like, how do you do this? And then there's a Texas Women's University Center for Women Entrepreneurs, which is near to me. And their courses are available to anyone, like nationwide, worldwide. And so I started taking classes with them too. They're free. And I was like, I think I can do this. And so it just eventually evolved into like, I'm gonna do this.
I love it.
So yeah, I just believe like, there are things that happen in our lives that we can't control, and just making the best of any situation. And so what came out of that, that kind of just necessity of like, I don't want to leave here. I still belong there, but I know I'm not supposed to be, like my time is over there, and not wanting to accept it was, I ended up leaning into this, like, okay, this is the next path for me. And this is feeling right. And I started seeing like all these signs, like, yes, this is where you're supposed to be. And what I'm excited about is that I can write my own definition of job and what that means, because I was very interested in, like I said, starting to present continuing eds, and my work wanted me to put their logo on it, but they didn't want to pay me for any time to do it. So I was like, 90% booked with patients, expected to mentor, doing these continuing eds that I was staying up till 3 to 4 a.m. to prep, and wanting to do research, which I didn't get the support for there. And I'm able to now set that job description up for myself. So that's one thing that was appealing about private practice to me. And another thing is just being able to meet people in the community. So I'm going to be doing like a community-based OT practice where I can meet them at their practice fields, in their backyard, at the local park. And so I'm not constrained to the space limitations of what can fit within the walls and ceilings of a building. And so, and not constrained to having to simulate real life, like we'll be doing real life. And so what started off as like me being very like, and I'm Christian, so I reference God. So I'm like, no, God, I'm not doing that. Like, like I'm not ready. To like him showing me the way and showing me the tools, and to it being like, this is exactly where I'm supposed to be. So I'm not launched yet. Hopefully launching soon.
I love it. Well, I think it'll be so very meaningful and beneficial for people. And I love that you're doing it. I love that you've been led into this. I feel like I've had a somewhat similar journey, like as far as like a little bit kicking and screaming, being moved into this like direction and then feeling like, oh my gosh, this is the best thing I've ever done. I'm so grateful that I am here doing this. So yeah, that's really, really cool. I love that that has been your experience. And I'm excited for the goodness that you're going to be providing for people. From different backgrounds and all the like community based. That's really, really cool.
Definitely appreciative of my experience where I was, but yeah, I can see where this is the right place now. So
yeah, just prepped you to be at where you're at and have the experience to get you here. So it is so good.
Yeah.
And I do want to talk about your experience with the medical journey and work history, but I think let's hold off on that and come back to it.
Sure.
First, I'd love to hear like some of the things. Well, tell us a little bit about kids and concussions. Like, what is different? Is there a difference for little ones having concussion versus older teenagers or adults? How does that play into it?
Yeah. So, it's interesting because the research I've read thus far says that like it actually takes kids longer to heal, which we would think is like kind of the opposite because their brains are more plastic, right? And I found, with my youngest ones, I have found that they've healed quicker. So that's just like a clinical observation, but I think it's different for everybody. And I think one of the biggest difference in where I was before, we saw birth to 21, but we didn't get a lot of that younger population. I think they tend to go to home health. I had a kiddo that was like 6. I had 6 and 7, but I wouldn't get the younger kids. So I think they tend to go to home health. I think they tend to go undetected as well because parents don't know, or it looks like, something else, like they might just be cranky or, something like that. And also because kids don't have the life experience to know, or like necessarily the cognitive or verbal skills to know, like, I don't feel good, this is different, and they're not telling their parents. I think that's really one of the biggest difference with kiddos. It's just not having that comparison or those, verbal skills to be able to say, my head hurts or my eyes are fuzzy or, like, and that's what I notice.
That's such a good point. And it's so hard because as we've said multiple times on this podcast and even today, like it's an invisible injury. You can't see it. Like there's not necessarily, other than, maybe you notice that the kid is a little bit more grumpy than usual, but that could mean anything, right? Like there's many different reasons for that. So yeah, I think just getting awareness out there that little ones can get concussions. It is a possibility. And I guess it's hard too, because little ones hit their heads so often that it's really hard to know if it's scary. Like, should you be scared and like trying to do something about it? What can you do for little ones? Like, how do you approach that if it does come up?
I mean, I never see them that soon in the journey, it seems like. But I mean, I think definitely as far as like seeking medical attention, if there's any like visible open head injury, and this goes for anyone with a concussion, but if there's any like visible open head injury, if there's nausea and vomiting, if there's a seizure afterwards, a loss of consciousness, any breathing issues, that's definitely like ER right away. Otherwise, following up with the pediatricians, and pediatricians are really great, but, they have to know like a lot of different things. So they may not totally know the signs and symptoms of a concussion. And like I said, with those littles, it can kind of cross over and look like other things. So, I really am a strong advocate for concussion clinics. And, in my area, there are some community-based, but there are also some related to hospitals. And so concussion clinics are a neurologist, a pediatric neurologist, somebody that's able to kind of sift through those. Well, I'm not sure, but I'm kind of worried, like they're the experts on that. And so I think just getting them, somewhere like that as soon as possible to help tease out and help parents figure out, because parents have so many things to to worry about on a daily basis. So just kind of getting that care as quickly as possible.
Yeah. And what would you tell parents to be looking out for if there's not anything like, again, significant, like obvious, we should go to the ER? What kinds of signs how would it present in a little one? And a little one, I mean anywhere from 0 to like old enough to explain to you what is happening inside of them. So probably
if they're able to verbalize some common signs and symptoms of concussion are, having sleep changes, whether that's sleeping more or sleeping less. It could be either or difficulty staying asleep, some physical issues like dizziness, headache. And the literature so often lumps vision into physical. And everything's connected, but I kind of like to separate that out because what you look out for is just very different. If they're complaining of like blurry vision, double vision, eye strain, headaches with schoolwork, difficulty concentrating if their grades are starting to slip. And then cognitive issues kind of overlap some of that too, like the difficulty concentrating, difficulty learning new things is a big one too. Not being able to retain new things that are learning or recall information that they're learning, or even recall some other, like family information, like things that you did yesterday or, something like that. And then two, just, behavioral changes. They're more irritable, more emotional with the littles. And it can come out with, just things that they say that you think are a little off, and I always say, like, parents, like, you're the expert on your kid, and if you notice them, like, squinting, rubbing their heads, and avoidance and being withdrawn from things that they normally find pleasurable, that could be either a behavioral sign or they're just too overstimulated or they don't feel good. So I think that's a big one I hear about too, a lot of times from the parents of the littles.
Yeah, thank you. And a couple other things that, as you're talking, came to my mind that we see with adults that I could see coming out for kids too, but maybe, again, them not necessarily saying, hey, I am having trouble keeping my eyes on the words as I'm reading. But if they have sudden difficulty with reading, or reading is really hard for them, I like that you mentioned if their grades start slipping inexplicably. And I think too, maybe you can tell me if I'm wrong on this, but I imagine that maybe somewhat slower responses, or kind of like a slower processing to answer questions, or even physical responses to things that could be a sign of it too.
Yes. Yeah, definitely that processing time. And reading is a really big one because and I don't know if you want me to get into this now, but yeah, there are the three most common visual issues related to concussion are accommodative insufficiency. So that's like your focusing system. For those of us that remember cameras before you just point and click on your smartphone, and having to like manually focus, and you could tell when it was blurry and when it wasn't. So that focusing system. And then convergence insufficiency, so bringing your eyes together to do things up close, is typically harder to do. So reading, any like fine motor activities, and then also copying from the board where you're having to shift your gaze from near to far. So copying from the board, driving, playing sports, you're having to, frequently do that. Or if it's a kid that's in band, having to like read the notes and then look back at the conductor. I was a sports kid, so I'm like, is it conductor?
Yeah. That's right.
And then saccadic, so accommodative insufficiency, convergence insufficiency, and saccadic deficits. So saccades or saccades, some people call them saccades, are fast eye movements you use to look between different targets. And so that's also, we use those fast jump eye movements with reading. We use them again, like with driving, looking back and forth when we're playing sports. Like if you're playing soccer, running down the field, you're always constantly looking, where's the ball? Where's the goal? Where's the person? So I don't run into them. So those we know are the most three common visual issues, and how that can translate to like, okay, well, I'm a parent, I don't know how to look for that stuff is kind of some of the same things we talked about, that blurry vision, that difficulty shifting focus near to far. You may see them, kind of squint. Their eyes may water, get red or dry, and those headaches, sometimes dizziness as well. Let's see what else. Losing their place when they're reading, having to read the same things over and over again, missing words when they're reading or missing lines when they're reading. And then just that, it can eventually lead to comprehension issues because they're missing out on stuff. But you typically may not see like those comprehension issues at first, especially because kids are really good at disguising things and really good at learning how to work their way around things. So they may have heard it and used their auditory skills and heard the teacher say it, but missing it when they're actually reading. So
yes.
Good point.
Such a good point. So good. Thank you for that. I do want to talk about the visual stuff too. But I think, again, I just want to bring out a couple of the other points that you mentioned, and kind of related to the visual stuff too, is like, if it's hard all of a sudden to play sports and they may want to withdraw or complain about going, again, they're probably not going to say, it's really hard for me to track where the ball is. And like, they're not going to be able to verbalize that. But if they're all of a sudden, like, there's behaviors coming out, they're more emotional about doing things that they don't understand, but it's hard for them all of a sudden. Like, I think if parents can be attuned to that, that will be really helpful for everybody.
Yeah, definitely that behavior piece. Yeah. Avoidance, things like that. Yeah.
Yeah, yeah. Let's keep going with kids specifically and like what parents should be aware of with managing acute concussions. And then I do want to circle back and talk about the vision stuff some more. So if a child gets injured during sports, or actually, I guess it doesn't matter how they got injured, should they be taking a break from sports and other things? Like, what do you tell people as far as time off and before like return to play and stuff like that?
Yeah, yeah. So, the old Rex were kind of like this dark room treatment where it's like, remove all stimuli, don't have them do anything. And I've still fairly recently had kiddos come, and said, I was told by my doctor to not do anything for 1 week or for 2 weeks. And again, PCPs are phenomenal entry points to the healthcare system, but they can't know everything, right? And so that information is actually outdated now. And what we know that is if we choose that approach, then their symptoms can actually become more severe, more symptoms in total, and it has more mental health issues because like no one likes feeling crummy and not doing what they like to do, right? And so what the newer recs look at is really more what's called like relative rest, where you're kind of just taking it easy for 2 to 3 days. And so what that looks like is like they're still doing their ADLs, kind of doing
what an ADL is. I know what it is.
yes. Activities of daily living. So still kind of encouraging those basic daily routines of brushing your teeth and bathing and, to whatever is their typical level, getting dressed, things like that. Low key things are okay. Typically, we say to limit screen time. So that's kind of hard if a kid can't like get up and run around, like, what do you do? And so trying to find, help them find some more low key activities like puzzles or Legos or coloring, things like that for like really just for the first 2 to 3 days. And a lot of times I get them whenever they're much further out, like a month and sometimes like a year or year and a half out. And so, limiting that screen time to prevent that eye strain, and also limiting the screen time within an hour before bed to help promote good sleeping habits. But really, we want to get them starting back with their activities as tolerated and, as soon as possible. But that's probably going to look really modified. And for the kiddos that I see, it is. So I typically see kids that are, and there's still a lot of floating definitions of post-concussion syndrome, I feel like, out there. But so, most kids are going to return to their normal level of function within about a month. And those are the kids I don't see. I see kind of that 10 to 20% that are still having functional issues. And so I use the return to sport strategy that's from the 6 consensus statement. And that's been around for a while now. They're a group of international multidisciplinary concussion experts that meets every 4 years, save the, pandemic, which threw the whole world off kilter. But they came out about a year ago with their most recent recommendations. And what they've been saying for a long time is, first off, when in doubt, sit them out. If you think they've had a head injury, sit them out until they receive proper medical care. And then we're starting them on like the return to sport strategy. And I use that as my guide, whether they're an athlete or not. And kind of an important note about this too is every state has a law that says, and in Texas it's called Natasha's Law, but every state has a law that if a child got hurt during a school athletic event, that they have to go through this through a return to sport protocol. And I say that loosely because it doesn't, like, not every state has a specific one that they use. And then they have to be signed off by a designated medical professional to return to the level on the protocol that has to deal with like contact. And so it kind of depends where you are. Like preferably that would be an MD or PA or nurse practitioner at a concussion clinic. But if people don't have those resources, it could be like the town's or the school's athletic trainer or something signing off on them, which I have feelings about. But but anyway, so we start the return to sport strategy, or sometimes it's called return to play protocol. And what is also very evidence-based is that they do not graduate from one step to the next until they've been 24 hours symptom-free from the activities we've done on that previous step. And that's to account for kids, like some kids have delayed reactions. So they may feel great during my OT session. And then they come back the next time and they're like, I had an 8 out of 10 headache for the next 10 hours, or I couldn't do anything. I was so exhausted. I couldn't do anything with my family for 2 days. That's not And then I think a lot of times people look for those physical symptoms like the headache, the dizziness. We also need to be looking at, like, are the visual issues being exacerbated? Are the cognitive or, emotional issues, those other things being exacerbated before we look at graduating to the next level? There's a return to learning protocol as well that I think maybe coming up a little later. But yeah, I always like to start with that return to sport protocol. I kind of, the one mentioned in the sixth consensus is very generic. There's a group, the paper, I think in 2014, it's by, bless you, by May et al. And I think they're in Atlanta, but they have some ideas. So if you're, like an OT or a new provider in concussion care, and you're like, I don't know sports very well, they have several sports where they've listed cheerleading and baseball. And so they give you an idea of what specific activity is on each stage. I've created my own for performing artists. I have like I said, I played several sports, but I also danced. So I have some experience with that. And a lot of times it just takes, talking back and forth with the patient and their parents and maybe the coach about, this level says light activity. What does that mean for your sport? And helping the kids make that connection. But as OTs, we're experts in task analysis. And so this is something that comes natural to us. So even if you're not familiar with those sports or something, there are ways to help guide. And, I've written return to equine protocols. I've written return to theater, but it just takes kind of some putting brain power together to know, like, oh, I'm not experienced with that. Tell me more about that. Or I'll YouTube, different things and everything. So that's as far as like the physical activities.
Love it. Okay. And is there any kind of like just generic, if a parent is like, okay, they've had this concussion, like I appreciate that you mentioning, like the old school, we don't just cocoon for 2 weeks, but as far as sports specifically, like, should they be benched for a week, 2 weeks, 3 weeks? Is there like a specific number for that, or it just kind of depends on?
No, it's really like just doing the low key for 2 to 3 days and then making sure someone who knows concussion care is helping guide through that protocol. Because I think, like I said, the average parent, I feel like, has so many things on their plates and isn't an expert in concussion. So I would definitely get that expert to help you. And then that return to contact, there is a risk of, even just a small bump. If we think they have a concussion, if they have just a small bump that's like equal or lesser, it could actually have a really big impact if they go back too soon. So they don't have to not do anything, but so for example, like with soccer, it would start off with like, okay, I'm doing stretching with the team, and I might be doing some light, like walking through plays, something like that. But really, like, I wouldn't try to do it alone as a parent, especially that return to contact part, because that really needs to be signed off by a medical professional.
Okay. And my brain is just like, the mom in me is like, okay, what about a mom who the kid got injured, like they fell off of a skateboard right at home? It wasn't like an official game.
Yeah,
or anything.
sure.
Like, what do you tell that mom? Like, hey, like, I assume it's a, hey, let's work it out. Let's figure it out together. But do you have any advice for her? Like, should she let her kid do skateboarding again? Should she keep him off for like a certain amount of time? Wear a helmet? Like, what do you tell him?
Are we, so is this like they have gone to a concussion clinic, or they're trying to figure it out on their own?
They're trying to figure it out on their own.
If they're having any of those symptoms earlier, I would really, try to get into a concussion clinic or neurologist, or at least the PCP, as soon as possible. I know that kid's going to be like, Mom, like, it's your, like blaming it on the mom and and I'm mad at the mom. But, like, you only get one brain, and just the chance of it, of an additional injury being a way worse, possibly, if they're having any of those symptoms we talked about earlier. No, but let's look at what is also enjoyable that we can replace it with temporarily, because, there are things our kids do that we can probably all agree that are very high risk for additional head injury. But, can we do something else? What are some other activities that don't have that risk of impact? Because at the same time, like, we don't, like I said before, like, we don't want those mental health symptoms, or the anxiety of participating, but they're probably kind of not feel the best and not feel like doing it. But yeah, I think trying to find kind of like a replacement activity that doesn't have the risk of hitting their head would be first step because I know sometimes it can also take a while to get into the doctor too. So
yeah. So it's probably just good to keep them away from places where they could hit their head again within a while, and then work towards building back into it. Because I do think that it is important to build back into it, but you do want to avoid getting a second hit to the head. And how do you deal with too when if the protocol says they have to be symptom free for 24 hours after doing the previous protocol stuff? Kids, a lot of times I think, and especially I hear Texas is pretty intense about their sports. Like people want to go to sports, like they might not tell you if they've had any symptoms, right? And it's all like, you have to base off of what they're telling you. How do you convince the kids and or the parents that this is worth taking time for?
Yeah. I mean, I think a lot of it starts with education because, we're kind of, since OT is more of a tertiary thing, and we tend to not get them until they've had these injuries. I think a lot of it is education in the community, trying to partner with schools and get the words out, making sure coaches know signs and symptoms to look for, making sure parents know signs and symptoms to look for. And that's part of, at least here in Texas, like what Natasha's law requires coaches to undergo some sort of training and for them to give parents, a handout with the risks of training. And that's not to say we don't want to scare people, like sports are good and physical activity is good and sports are good for more than just physical activity. But I think that's part of it. I think, legislatively making sure we do get things passed like that. So there are safer ways to play. We have laws now that protect, kids can't football, at least anyways, like they can only be in full pads and start tackle practice a certain amount of time before the games or before the season actually starts. And with, certain sports with certain ages, like they're not allowing headers in a certain age in soccer, because we know too that that kind of cumulative, sub-threshold, subclinical, which means they're not reporting concussion and they look fine, but we know that kind of those repeated hits can have an effect. And so I think that's kind of the first line of defense, is getting the educational and advocacy pieces in line. And then so when I do get them and they're working with me, I tend to kind of have a big sister talk with the kids and the parents too, and just remind them your goal is my goal. I want what you want. I want you to get out there. I'm a multi-sport athlete. I played sports in college, and I understand the pressure. I understand the frustration of not being able to do the thing that you love to do. And sometimes it feeling like you take one step forward, two steps backwards. But, I was just kind of if you do this my way, I mean, it's our way because it's a collective plan of care, but my goal is to get you out as soon as possible. If we force it too soon, it can actually make your recovery longer. So I need you to trust me and be open with me about how you feel, because I'm on the same team. I want the same thing you do. So that works with most of them.
That's good. All right. Excellent. Thank you. That's helpful to hear. So, and then you mentioned there's a return to learning as well. So yes, that was another question I wanted to ask you, is how about school? When do they need to be out completely for a little bit, or what accommodations and should parents be aware of and advocating for?
Sure. There's a mention of return to learn protocol in the consensus statements as well.
I'm not familiar with this. Can you say that word more slowly or spell it for me?
Yeah. So this, I have it pulled up. Actually, the most recent one is consensus statement on concussion in sport. The 6th International Conference on Concussion in Sport, Amsterdam, October 2022. So the consensus statements are the ones that, like I said, it's an international multidisciplinary group of people. I would love to get an OT in there. There's not an OT in there, but they are typically more medical doctor and I think some psych, and they review recommendations for medical care for concussion. And so they're the ones that kind of created what I think most of us use as this gold standard that they have, the return to, it used to be called return to play, but I think they retitled it return to sport strategy. So they have return to sport and return to learning. The paper I actually use the most often, and what I like to give as a handout to parents, is a return to learning protocol from Halstead. And I can send you all these because these are free online. And I try to post them on my Instagram too. I don't post anything that you pay for because there's copyright issues and stuff, but it's by Halstead in 2013. And McAvoy, I think her first name's Karen. I think she continues to keep a website. She's out of Colorado, and I think she tends to keep it a website and update it, but they kind of did the same thing as that other group and took the return to learning protocol and said, like, here's what this means. And so they have this nice table that's a list of like common symptoms of concussion and how it can impact school function. And then they have a list of common school accommodations as well. And so school accommodations are hard because under IDEA, schools have 45 days, and I think it's actually like school days, not like calendar days, from the time a parent or teacher brings a concern to get testing done and accommodations in place. Well, concussion recovery happens faster than that. Concussion needs are faster than that. And so what parents can ask for that's typically a faster process than an IEP is a 504 plan. And that's typically more for more temporary conditions like concussion. And so we try to get those accommodations in place as quickly as possible. Where I worked previously, the medical team, like the doctors and NPs and PAs, were really good about starting that process. And then when we would see them for therapy, whether it was speech language pathology or physical therapy or OT, we would add to that as well from our lens. And, explain to the parents, like, I know this is confusing, but this is what this means. Have your school call me because I want to do things. I used to do school therapy. And so I know, teachers have a million things to think about and however many hundreds of students. And so, if they're like, how do I implement this? They can call and ask me. But I really, this is something I go over with my patients and their parents at evaluation, is putting those accommodations in place, because that is something that can help give immediate relief, or at least like a decrease in the symptoms. And it can help them have a higher level of participation, which improves mood, confidence, things like that. And so because the process takes longer, I may tell the family, like, get this process going. You're going to give this paperwork either to like the school counselor or like the front desk person. They'll know who is the point person at your school that helps set up these meetings. In the meantime, I'm going to teach you this now so you can start using it right away. And so I, try to give them a couple of things that are whatever's bothering them the most, so I don't inundate them with like 17 recommendations. And then I'll give them a couple of things and have the kid demo back to me, not just say, I understand. Have the kid demo back to me that they know how to use it, and make it something, easy they can use in class. Kids can be very, just hesitant to use things that make them look different. So trying to make it something that's easy to use, that doesn't look so different, but also teaching them that advocacy piece of reminding the teacher, because they may not remember, and I try to like have them do discrete, and have them help me come up with a plan. Well, if you don't want to say something in front of your peers, like, what's a discreet way you can remind your teacher? And it might just be a little sticky note and leaving it on her desk. With one kiddo, I made an I need a break sign, and it was like her favorite color, pink, and we laminated it. And so if she felt like she needed a break to rest, like in a quiet place, she would just go up to the teacher's desk and put it on her desk. And then the teacher would kind of just nod and go. With workplaces, it's a little different. And that's something that's like, I'm still learning about, because, with kids, it's like, I've had several kids that have worked, but in the younger population, that's not a thing. So with my teens and stuff that work, it's making sure their bosses know that, and kind of having social work help me navigate, like, what are their rights and their regulations legally regarding taking breaks. And one of the kiddos said, like, oh, I take a break. She worked at a restaurant, and she said, I take a break in the freezer because it's quiet in there. And I'm like, are you sure that's do you get cold? And she's like, no, there's this amazing banana pudding and I eat it while I'm taking a break. I'm like, okay, whatever works for you. So having that kid and that parent be involved. And then you asked me about some common school accommodations I recommend: breaks in a quiet place, being excused from an assembly, eating lunch in a quiet place, but with some peers, like having some friends be able to go, because we don't want to isolate them and they're eating lunch alone. So being able to choose peers, if it's just, too loud, because cafeterias are absolutely nuts.
Overstimulating for everybody.
I get overstimulated. Yeah.
Yeah.
So kind of looking at the different senses, so that's like the auditory sense. Then looking at the visual sense, like, if they're losing their place, using blocking strategy where you put a piece of paper over part of the text and then it helps their eyes line up on the line. I try to switch them pretty quickly to a line guide, just because it is beneficial for the eyes to have more input, but sometimes it's just too much. So switching them to a line guide, then which
tell us what a line guide is.
Yeah, the line guide, and you can get them on Amazon. It keeps the rest of it visible, but then it has like a line at the top and bottom, so it helps their eyes on whichever line they're on, or they can use their finger or pencil too. I also like to use a slant board, which when I did school therapy, we had specific slant boards, but I tell the kids, like, you have a 3-ring binder, use your binder. And so you have it closed, and then with the ring part, like the larger part away from you, so it's slanting up, that gives the eyes a lesser distance to the paper when you're reading. And it also prevents neck strain and tension headaches that you can have from neck strain from looking down at the paper. So just getting it elevated a little bit. If that's not enough with the binder, I'm like, stick a book under it. And that's one of those things, like I said, that's inconspicuous versus using this, like, we have these big, like, corrugated plastic, like, slant boards that I use when we do school therapy. And I'm like, no one wants to use that. So yeah, that kind of line guide or blocking strategy, the slanted writing surface and reading surface, extra time on tests and a reduced workload. So if, it's like, I remember doing like 100 multiplication facts in 3rd grade. Like, if they're understanding it, like, we don't need to do 100 right now. And so kind of working that out with the teacher, like, what is the most important thing, or what are they needing more help on? Let's put more energy towards that. Also, let's see, there was another visual thing I was going to mention. Oh, colored filter. So I buy the Irlen kind, IRLEN, they're on Amazon. You can use like dividers just from Office Depot, but they typically have a sheen and it creates a glare. And kind of this like bounce back from the light. So I typically don't like those. I like the Irlen type. And what it does for those of us who are younger, old enough, we're not old, but yeah. So the colored filter overlays are kind of like the projector paper our teachers used to write on. Mm-hmm. And it's really a subjective thing where the kids just like telling you, like, I'll try all different colors. Sometimes I stack multiple colors, and it makes the letters more crisp. And it also blocks out that harsh, like white paper just has a lot of like reflection from the harsh lights that are in most public spaces too. And so it blocks that out. They can also be used on the computer screen as well. Some computers have already that, like, they might have like a tint function. If it's something that's like, sometimes an optometrist will recommend a tinted lens. So that's something that, like, you definitely need to get the kid to an optometrist to do. But if it's like short term, something like the Irlen filter where they're just using it to read to give their eyes a break, it's fine for OTs to recommend. I also recommend on the phones putting them on like a night shift mode. So just blocking out that blue light if we can. And blue light is good. It does help us with our alertness levels, but sometimes it can just be really harsh. And it does, especially at night when your brain's trying to, because, you tell the kids to be off the phone for an hour before bedtime, and it's not going to happen. So setting that so the blue light filter is on at least prevents as much of that signal being sent to the brain that says it's time to be awake and alert. So those are kind of the visual ones. I'm like looking back through here to make sure. Yeah, reduce load, quiet places. Also just pacing. So like, I've heard of kids being out. You had originally mentioned like sitting out completely from school. I think we use kind of the same rules as the return to sport strategy of kind of that low key for 2 to 3 days, but we really want to start participation as soon as possible. And so if that means, and I know this would be like so hard for parents, kind of like one class or whatever, but if that means we're going to one class and then taking a break, maybe in the nurse's office or counselor's office, wherever the designated place is in the school, I would rather them and there are some classes that just provoke the symptoms more than others. Typically like math is one of those. So I would rather them be able to go to 2 or 3 other classes in a row and miss one, then try to push themselves through one and be done for like the whole day. So it's kind of just that pacing and constant asking the teacher and putting our heads together and seeing like, let's pace it, how did you feel after this class? And also making sure their meds are at the nurse's office and they know when to take their meds. So a lot of times I would tell my kids 4 out of 10 because they can kind of get from that middle pain range to severe really quickly. And, if we don't get on top of that, it's hard to come back down from like the severe headaches.
Pain medication is what we're talking about.
Yeah. If the doctors have recommended pain medication and their headaches are that bad and migraines are that bad, then making sure it's at the nurse's office and making sure they know or their teachers know how to ask them how they're feeling to then, send them on to the nurse's office just to stay on top of that. So yeah.
So many good advice there. Like so much good stuff. I knew that an OT would have a lot of good recommendations for things to do. So I appreciate those. And I think those will be helpful. I like that color filter overlay as well. That's not something that I had thought of or seen before. I know that, like you said, optometrists will sometimes recommend different colored glasses, but this is like, something that anybody can just do. So that's good. I like it. So tell us, let's see. Well, let's talk a little bit more about the vision stuff. I know you mentioned some of the vision concerns that kids can have, and I just want to say to everybody listening that your Instagram is fantastic and has so many good options and ideas and suggestions and great stuff. So it's the Concussion OT, right? That's how they can.
Yes, it is. Thank you so much. Yeah, I need to get back doing it consistently. Life and school. I'm also working on my doctorate right now. So life and school have been rather busy. And I would like to get back to doing things more consistently soon.
Yeah, well, no, and that's okay because everything that's out there already is so good and like lots of really good like videos and things that you can see to help with ideas of how to manage these things. So I think that's so good. But are there any other visual suggestions, like things that you recommend to people to be aware of or try if their vision is bothering them?
Let's see. From a parent standpoint, I feel like we've discussed a lot of it. From a provider standpoint, extraocular movements. So like we talked about saccades, pursuits are also the slow, like being able, we call it tracking. I feel like in OT school, those slower movements can also be impaired, even though that's not one of the top 3 listed in the paper. What else have my kiddos complained about? Some complain about oscillopsia, which is the words appearing to move on the page. I feel like those are the big ones.
Is there something that you can do for that?
And the oscillopsia is something that's not as common. And I'm still trying to, understand more about it. And from what I understand, it has also to do with like the vestibular system as well. So I'm still learning more about that one. That's a definite like red flag for me. And also regarding the visual stuff. So if I have any fails on my visual exam, I am automatically referring to, if it's just accommodation, so like that focusing system, I try to just refer to the general optometrist. If the kid's never been to an eye doctor before, never had a general eye health exam, general optometry. Typically I'm going to neurooptometry, but then it's like, we don't want to overuse. But if it's any of this other stuff, I'm really going to neurooptometry. And I use that term loosely. There's not really a clear definition. People call themselves neurooptometrists or behavioral or developmental optometrists, but it's really important. I feel like OTs were kind of gatekeepers because we are the ones who notice these symptoms. I'll get a kiddo and it'll say like cranial nerves all intact, from the ER or something. And I do their visual exam. And we know that, the eye movements that we see with pursuits, which is kind of just that compass, up, down, left, right, in the diagonals, those have to deal with cranial nerves 3, 4, and 6. And so I'm like, if they're cranial, they're like cranial nerves intact and full range of motion. And I'm like, they can't track cross midline or the last 30 degrees of left gaze or, whatever. I'm getting neurooptometry on board right away because I can think I know what's going on as an OT and, but it's not within our scope to diagnose. And there may be other issues underlying it. And then also in addition to getting an accurate diagnosis, neurooptometry may recommend a certain type of lenses, whether it's just to account for a changing acuity or a prism, which has to do with kind of what we refer to kind of simply as like eye alignment. And so it's just really important to get them on board and to collaborate with them, have relationships with the neuro-optometrist in your area, because co-management is really important, and know what those neuro-optometrists are comfortable with you doing. Because like I know how to do some advanced binocular vision techniques. Some neuro-optometrists would rather they do it. Some just, are just so slammed with evaluations that they're like, I want you to go ahead and do it, so having that working relationship. And I think just constantly like learning from an OT standpoint, learning about these exams. I'm really passionate that we should all be learning these in school and that for every population, because for pediatric care, it transfers over to developmental issues. And even if vision's not your passion, I think, it's a specialty area and it takes specialty training and constantly honing and having a mentor to make sure you're doing things accurately, staying within scope. But I think, I look at it also as we do other specialties. Like I'm not a specialist in feeding, but I underwent training to identify feeding issues. I'm not a certified hand therapist, but I can make my way safely through an exam and know that I need to refer on to somebody else. And so, so is with vision, that I think, we all need to know how to do certain exams, because early identification is the key, a thorough evaluation is the key to then getting other things on board. So that's really and that's why with my research, I decided to focus on the exam part, because the exam determines your plan of care. And then from there, as an OT, you kind of know what you need to work on and how it, with vision, you can work on it a little bit in isolation, but as OTs, since we're focused on function, I'm always trying to tie it back to function as quickly as possible. I may start off, I use a lot of dynamic systems theory, motor learning theory. So we may be starting off with just some seated eye exercises. So for saccades doing their eyes jumping back and forth. And I use various things to do that. But, that's if they can't tolerate being able to do that with movement. We're doing the patient stationary, the activity stationary, and just following those same OT theories that we all learned in school and overlapping it with the return to sport strategy. So it's we may start stationary and then we're getting to where the patient stationary and the task is dynamic, or vice versa. And then working our way up to real life where they're both dynamic, where I'm having a kid jogging on the treadmill, at the same time we're doing saccadic activities. And this is the hardest level, and I have a shower curtain in the background that has these wavy, things, and I might be playing music to hit all of their senses. And so it's, sticking with the research, knowing what you don't know, learning what you can and what's within your scope, and then doing our best to make it functional and meaningful for the patient.
So good. I love all of that. Thank you. And I think too that it's an important point to make, that a lot of times the visual piece is so important, and people don't realize that is an issue that they're having.
Yeah.
And it makes such a big difference, because it is one of those underlying things that the brain is spending so much energy and effort on, that if it's not working properly, it has this cascade of symptoms that keep flowing, and you don't know why. You're like, oh, I'm really tired all of a sudden. I've got all this brain fog, and you don't necessarily connect it back to the fact that you were just trying to use your eyes to do this task, and that's what's causing it. So it's really important for people to be aware and to get that testing done. And neuro-optometrists can be a fantastic resource. So I love that. Yeah. That's been brought up. Thank you. Okay. I would love, if you don't mind sharing, I know that you'd mentioned before that you've had experiences on your own personal medical journey and with work history that kind of may have some overlap with issues that people with concussions are managing. I'd just love to hear what you want to share about that, and how that impacts the way that you care for your patients.
Sure. Yeah. So it kind of really started off with a diagnosis of infertility, and we've eventually gone down the path for in vitro fertilization, IVF. And then kind of while that had started, and we were starting treatment for that and exploring our different options, I had a work injury, so completely unrelated. I was working with a new kiddo that I had just gotten that had a concussion diagnosis. And we were doing the scooter board activity where we had Connect 4 launchers. If you don't have that game, it is like a favorite and it's amazing. It's like regular Connect 4, but there's this little launch pad and it's a horizontal surface and they kind of like fling it up onto this pad and you're still trying to, make 4. And so it does, it deals with some eye-hand coordination skills and some saccadic skills and some motor planning and depth perception and problem solving, adjusting the depth. And so, like I said, I hardly work on anything in isolation. So I'm trying to also overlay physical activity and peripheral vision and motor, planning. And so I have like the game pieces on one side of the gym, the game on the other, and we're using a scooter board to pedal to the other side of the gym and get however many pieces, And so since I prefer for the kid to be on their stomach because they get more proprioceptive input from the floor that way. And it can help decrease symptoms of dizziness and stuff, especially when they're having to turn around a lot. But it was a newer kiddo and he was younger. And I was like, I don't know totally what his, impulsivity control is like or his awareness. And so let us do sitting on our bottoms instead of going head first, with this kiddo that's had a concussion until I know his safety level. And I'm tall. And so sitting on this scooter board that's like a couple of inches off the floor, I turned and I just immediately felt this tear and I tried to get up and I couldn't bear weight on it. And I had a labral hip tear. And so it was just this freak accident, this thing that happened. And I actually had asked if we could not use workers' comp because we were supposed to start IVF the month later, and workers' comp, I think everywhere is known for being slow. And I wasn't allowed to do that. So I had to go through the workers' comp process and it did not work appropriately. Like I didn't get an MRI till 3 months later. And then they tried to say it was chronic. And I'm like, well, yeah, because it's been 3 months. And it was just this whole mess of like, okay, we'll approve a little PT and then we won't approve anything. And then we'll approve an injection and then we won't approve anything. And I luckily had an amazing PT and an amazing doctor. And the doctor was like, we've done conservative, you need surgery. And I was like, I've never wanted, obviously surgery is not what somebody wants to do, first of all, but I'm like, I agree. Labrums don't have much of a blood supply. They don't heal on their own. It's a soft tissue. So what's left next is just to reattach it. And that's when workers' comp denied everything. And I decided to appeal it because I've appealed things for my patients. I know how to do this. Well, that process took several more months. And in the meantime, I was on accommodations at work to where I couldn't lift over a certain amount. I couldn't see anyone with balance issues. And so that's the only time my concussion caseload wasn't 90 to 100%. And I don't idle well and I like to be useful. And, my dad's always been put in an honest, hard day's work and integrity and, all of that stuff. And so I started seeing some ortho patients, brushing up on ortho skills. I started being involved with our DEI committees, some research they had going on, which was really neat. So I got to see these different aspects of care, but it was not how I like to OT. And in the meantime, because of those restrictions and because it was a hip injury, my infertility doctor was like, we're not going to try to get you pregnant because of all the strain that it puts on your hip. So it was 1.5 years till I finally got the surgery and the rehab that I needed to heal. And it's just, I think that overlaps with concussion, even though I haven't had a head injury, just because the similarities are that it's a medical diagnosis. It's something that was unexpected and immediately impacted my function. I was cut off from the occupations that I love doing, the things that bring meaning to me and a sense of purpose. And I loved your podcast with Dr. Spangler a couple of weeks ago. I was like, yes to all of this, because you do go through this grief of this is not how I pictured my life. And there is loss. And I lost friends. I lost colleagues because of it. The system didn't work the right way it was supposed to. After my surgery, I was never integrated back into my work unit, even though my doctor approved me to. And we were sending month after month, requests to be back into my work unit, and somebody wasn't following protocols. And then it was the perfect opportunity for some people who had already been bullying me to spread rumors, and they spread very serious rumors and got HR involved, and they knew that the rumors were absolutely not true. I don't know why they spread them, but it just got to the point where, being bullied, and I was just like, what, like, their bullying to my face wasn't working. So now they're like bullying me when I'm not even there to defend myself, and the whole HR process was a complete mess too. Like, it was just, had reported a couple of these people before, and I reported them again through 2 levels of management and 5 different HR people, and reported also my department person who was deciding, that I wasn't able to come back because she wouldn't agree to meet with me or give me any real answers. And I was being honestly taken advantage of for my medical, like she was saying it was my medical, and it wasn't my medical situation. There were other things going on that I knew about. And so I reported these to 5 different people in HR, and everything just got brushed under the rug, which was very disappointing, because I think from a patient care perspective, this place is a very good place. But with my situation, and my mental health tanked, and I'll put a trigger warning on what I'm about to say, because I did start having suicidal thoughts. And it was never to the point of like, I never had intent. But I was just like, I can't be an OT and I can't be a mom. Like, that's all I want, and like, what's my purpose here in life? And I just felt very lost and cut off from those occupations. So, relating it back to concussion, I very much understand. I've had patients that have had issues with, mental health and with suicide. And that just also speaks to the volume of how important OT is and how important it is, to get back into these functional activities and things that are meaningful to people as soon as possible. Because my patients with concussion have reported all these things: bullying because people don't understand it and they look fine. And you start getting hard on yourself, and then you start questioning yourself. And I'm like, why am I questioning myself? I know I'm being honest, and I know I'm motivated. And so, that's something that I feel like isn't talked about enough, is the mental health side. But it's having that injury is a disruption to your life and a disruption to your sense of self. And another thing that Dr. Spangler said that I loved was, I found a path to healing when I found purpose and meaning in the pain and in the grief. And I started leaning into it. Like I said, I left there with no plan, but it was like a move I needed to make, because the bullying had been increasingly more severe, but I was happy there. And I would, but I love this, and I love most of the people. And we had a really amazing relationship with the doctors and our referring providers from the concussion clinic, that they had kind of elevated therapies to like primary care. And so they were like, a kid's like, can I return? And they're like, should I sign them to, sign off on their contact sports? And they would call me and PT. Sometimes the kids saw the speech language pathologist, not often, but they would call us. What do you think? Or they would look at our notes, which is rare. Doctors don't always look at your notes. And they would be like, Emily says you're not doing your HEP, your home exercise plan. And like, no, not yet, And so we had this, it's just a really good thing going. They were going to be paying for part of my doctorate. I had some research ideas lined up there because we had amazing equipment. So like I said, I was like this toddler kicking and screaming. But when I realized how much the stress was impacting, possibly impacting my ability to conceive, I just had to make this plan right away that was just like, if I want to have the chance of having kids of my own, I have to leave this place. And so sometimes, with concussion care too, there are drastic decisions kids have to make. Sometimes they're like, it's my 4th concussion and I need to stop playing football. And those are hard decisions to remove yourself from the things that you love. But, I think just like with anything that good can come out of it, I'm not thankful for those people. People are like, I'm so glad they were the catalyst. I'm like, I'm not glad, no, I'm proud of me. I'm proud of my inner circle and the people who encouraged me. I don't know what was going on with those other people. I wish them well, and I hope they find a path to healing for whatever, was that they weren't getting healing from. But I made that decision, and my husband helped me make that decision, and my inner group supported me. And also, since we're talking about such a sensitive subject with mental health issues and suicide, I want to there's a suicide prevention line. The number is 988. It's through NAMI, the National Alliance on Mental Health. If you or your loved one are in active crisis, the first step is going to the ER. in getting mental, in getting that healthcare. If for some reason you can't safely get to the ER, that 988, the Concussion Legacy Foundation also has some great just kind of ongoing, and I know I'm probably forgetting someone, but just those ongoing mental health resources. But it is, it's hard when you're cut off from the things you love, but there's hope. Like, just, there's going to be haters. Don't listen to them. They don't care. They don't care. Like, listen to the people who love you. There's hope. There are people that love you. There is value. And I think that's one thing I learned too, is like, I was putting, like, being an OT is so central to me. Like, it's a lifestyle to me. It's a calling to me. But I was putting too much value in my job as an OT. And I was tying my value to that too much. And this made me realize it's not who I do, but what I am. So if anyone else that's going through a hard time, whether it's concussion related or other medical stuff or what, like, your value isn't who you are. And like, don't listen to the haters. And I think, letting yourself feel all the feels, like leaning into that, like, the feelings that are considered bad or negative, like all of our feelings and emotions are there to teach us something. And I don't like to label things as bad or good. And so letting them teach you something is giving yourself the space and permission to grieve things that are lost is, I think, a big step to healing. And knowing that, like, the stages of grief aren't a checklist. Like, I just was like, oh, I'm done with anger. Bye. Like, I want to be happy and, like, rainbows and unicorns now. But like, it comes back, and it still comes back for me every time, like, a tuition bill is due because, like, work was supposed to pay for part of that. And when I started my research courses in school, because I was cut off from these amazing resources that I had to completely reroute to a different research project. So those things still come back, and it's an active process. I'm still working with this amazing therapist, and she was like my fourth one. So I think finding the right person to help guide you through these things is a big thing too, but giving yourself the space to grieve, allowing yourself to feel the feelings. And there's a bitterness aspect to it too, and not staying in that space for too long. Like that, like I said, it's a feeling or emotion, and it can teach you things, but like, and not using those circumstances to justify your behavior towards other people, but learning it to grow and, be a better person and learn more about yourself. And then, if so, you feel called to use it to encourage others, because I think sharing our story is powerful. I think I'm an open book, so I tend, I tend to share more than others, and I respect people's decisions to share or not to share. But I think, even in a small way, like letting people know, this, like, with my patients, I don't have to give them this whole long story like I just gave you, but just, letting them know, like, I've been through hard stuff too. And it did, can I say suck on here? I'm like, is this G or P? I'm like, letting it know, like, it did suck. And I do know how it feels to feel worthless. And I do know how it feels to be disconnected from the things I like. And we're going to use this as motivation and fuel to find a path forward, because there is hope there.
Beautiful. Thank you so much for sharing that. And that's a lot of high emotion, like, big things. So I appreciate your openness and willingness to share that and the lessons that you've learned through it. I think that it's important to talk about the mental health aspect of this. And I do appreciate you mentioning the suicide prevention line as well, because that is something for parents to be aware of, and kiddos, anybody experiencing it, like, just know you're not crazy. you're not broken. And this is the thing that you're going through, and there is hope and there is help. So, thank you for sharing that. Awesome. Well, this has been such a good, like, so much good stuff shared here. I really appreciate it. Is there anything else that you want to make sure that we touch on that we haven't talked about yet?
Oh man, I think so. For providers, like, OT belongs in this concussion space. It is still hard to find us, but OT belongs here. And I think we're not only do we belong, but we're vital. Also, like, the team approach is best. We need each other. I see some kind of like fighting over this space, and I'm like, stop fighting. Like, we all have a unique lens and bring something to the table. I think for caregivers, listen to your child. You're the expert on your child. Advocate for them, but know you're not alone as well. That and keep being their voice. Like if you're not getting the answers you want, keep pushing. Go to a different clinic. And also be aware of people that are one-stop shops. Like there are clinics that can be one-stop shops. And I think where I was previously, we had things very well run. So there were multiple disciplines, that you could go to. But I think if there's one person, and I'm seeing this crop up a little bit in concussion care, if there's ever one person that claims they're the end all be all, that is not what the evidence calls for. I can, until the day I die, I can take certification after certification, and I will never be the best person to address every single thing. This is a team approach. And for those diagnosed with concussion, just because some of the things we've already said, there is hope. You're not alone. There is help. And also kind of going back to that, having tough life situations, I think there's so much emphasis on being strong. And, I saw that with one of my kiddos in particular who kept having symptoms. And I'm like, you seem like you're doing well. He played a sport that his father had played in college, and he didn't want to tell his dad he didn't want to play anymore. And so just know that there are people you could talk to help you talk about those things with your parents. OT is one of them. But also know that being strong doesn't always mean pushing through. Being strong means
amen.
Sometimes taking a break. It means sometimes saying, this is too much for me right now, and allowing yourself that break. Sometimes being strong means saying, I need help. I need a therapist. I need a friend to remind me to eat something during the day. I need that teacher to remind me, ask me what's my headache. So being strong isn't always pushing through. Being strong looks like a lot of different things, and it all helps healing and recovery.
Yes. Oh my gosh. I really, really, really love that. All of that, but especially that last point, being strong does not always mean pushing through. That's so powerful and so important for people to hear and believe because that is the tendency, is to push through, be strong, go, just make it happen. But really there's a lot of strength that it takes, and vulnerability and openness to say, hey, I actually need some help and I'm not doing okay. So that's huge. I really, really appreciate you saying that. Fantastic. Thank you so much. So tell us, if people want to hear more from you, get more of this amazing stuff that you have to offer, how can they find you? What's the best place to look?
Yeah. So Instagram's typically the best place. For providers, really, at the Concussion OT. I'm starting to work on, trying to get my marketing beefed up for my work, my new job. And that's at Summit Concussion Therapy. So Summit, like a mountain summit. And that's going to initially be clinical care, but I also want to evolve it to offer some mentoring for other OTs that want to do concussion care. Because I think you go to a weekend course and you're like, I learned all this and I want to try it. And then you don't have this mentor that's like, what's normal and what's not, and someone to bounce ideas off of. So those two places. My website's in progress too. It's summitconcussion.com. So hopefully get that up soon too.
Awesome. Fantastic. Well, thank you so much for being here. Thank you for what you're doing and for the passion that you have for this. I can see good things happening because of where you've led and the experiences you've had. And I think it's a really good and beautiful and important thing that you're doing. So thank you so much.
Well, thanks for the opportunity, and thanks to your listeners for your interest.
I'm so glad you listened in today. I hope you have gained some helpful insights and inspiration regarding dealing with and recovering from concussions. My goal is to create more awareness and education about concussions and the fact that there is so much that can be done to improve life after someone has had one. Help me spread the message by liking, commenting, rating, and subscribing to this podcast, and share it with others who would benefit from hearing it. There are more resources available on my website. And again, if you or someone you love would benefit from concussion coaching, sign up for a free consultation using the link in the show notes or at my website, www.theconcussioncoach.com. Thank you. See you next time, and take good care of that amazing brain of yours.